Calcium is a key nutrient, especially even before pregnancy begins. It helps build strong bones and teeth and supports muscle function, nerves, blood clotting, hormones, and blood vessel function. Hi, it's Parent here. So, if you're planning a pregnancy, making sure your calcium intake is enough is already important. The recommended amount is 1,300 milligrams for age 14 to 18, 1,000 milligrams for age 19 to 50. These needs stay the same during pregnancy as well. So, let's look at where you can actually get calcium from. The best sources are daily products like milk, yogurt, and cheese. You can also get calcium from vegetables like kale, broccoli, and bok choy, and from fortified juices and plant-based milk. However, calcium from plant foods is absorbed less efficiently than from dairy. When diet and supplements are combined, calcium intake improves. But still, some groups are more at risk of low intake, including younger women and those with certain backgrounds. Now, let's talk about balance, because too much calcium is also possible, even if it's less common. The upper safe limit is 3,000 milligrams for age 14 to 18, 2,500 milligrams for age 19 to 50. So this is why getting the right amount, not too little, not too much, really matters even before pregnancy begins. Now, let's look at calcium during pregnancy. Getting enough calcium during pregnancy is important for both the mother and the baby because it helps build and maintain strong bones and teeth. So, calcium supplementation during pregnancy may also reduce the risk of gestational hypertension. It may also reduce the risk of preeclampsia, which is a serious condition that usually occurs after 20 weeks and involves high blood pressure and protein in the urine. However, research shows that this benefit mainly applies to women who already have low calcium intake. For example, less than 600 milligrams per day. So, calcium supplementation for this purpose is usually recommended in populations with low calcium intake. Also, it's important to know that much of the evidence in this area has some methodological limitations. Now, let's look at what studies show. A 2024 analysis of 26 randomized trials, including over 20,000 women, found that calcium supplementation reduced the risk of preeclampsia by 49% and gestational hypertension by 30%. However, it didn't significantly affect other outcomes like preterm birth, low birth weight, or maternal and newborn mortality. Similarly, a 2020 review of 30 trials with over 20,000 women found that both high-dose and low-dose calcium supplementation reduced the risk of preeclampsia by 51%. Lower doses, under 1,000 milligrams per day, reduce high blood pressure by 47% and preeclampsia by 62%. However, many of these studies included women already at high risk and had a higher risk of bias. So overall, calcium seems helpful mainly for women who are not getting enough from their diet. Now, organizations like ACOG and WHO give additional guidance for pregnancy, especially to help reduce the risk of preeclampsia. Research shows that women with low dietary calcium intake, for example, less than about 600 milligrams per day, may benefit from extra supplementation of 1,500 to 2,000 milligrams per day. However, if your diet already provides enough calcium, you don't need this extra amount. The higher range is meant as therapeutic supplementation to support maternal and fetal health and prevent complications during pregnancy. So, as a summary, recommended daily calcium is 1,300 milligrams for age 14 to 18, 1,000 milligrams for age 19 to 50. Upper safe limit is 3,000 milligrams for age 14 to 18, 2,500 milligrams for age 19 to 50. Now, for pregnancy, organizations like ACOG and WHO recommend extra supplementation only for women with low dietary calcium intake to help reduce the risk of preeclampsia. However, if your diet already provides enough calcium, you don't need the extra dose. This higher range is for therapeutic support, not the standard daily diet. I appreciate your time here. Those are my social media accounts. You can follow them for more informative videos. See you in the next video.